Hey there, here's what's coming up in this episode.
When you have hydration in your tissues, a hydrated tissue looks younger, acts younger, thinks younger, is younger. Without having the proper estrogen and water metabolism, your tissues are going to act pathologically crazy. And you're going to have frozen shoulder and tendonitis and joint pain, brain fog. I mean, it just goes on. Bladder infections.
Yeah.
So plump and hydrated is the message.
And
plump
where do we get our plumpness in our bodies? Our estrogen.
It's a water-loving molecule, you know.
Welcome to the My Aloof Vagina podcast, where we explore the distress and surprise of our midlife transitions. We take menopause seriously, but we don't take ourselves seriously. And we believe that learning what to expect in perimenopause can be entertaining. It's inevitable, so we may as well equip ourselves and have a good time. I'm your host, Martha, and I have a doctor on this show. Our first doctor, Dr. Wendy Chorny. You're going to love her, and you're going to love her approach. This is not a dry medical episode. In fact, I have been on the hunt for the perfect pelvic floor specialist to bring on the show ever since episode 3, when we talked about incontinence for the first time. And she is it. She's the one. I needed somebody who brought authority, who knew what they were talking about, who could talk about a lot of things, but who also understand that we're here to learn, but we're also here to have a good time. And we had so much to talk about, and we covered a lot about women's health and pelvic floor health. What do the Lion King and existential dread have to do with your experience of perimenopause? Is WW in your medical chart? And if it is it time to push back? What if the medical system treated perimenopause the way it treats pregnancy? Is perimenopause lowering your self-esteem? And what's really important about being 35? And why might you want to text your young friends as soon as you're done with this episode? It's a lot, I know, but you'll get the answers, all of them, in this episode. So stay tuned. Since it's going to be a lot, I want to remind you, as always, I've got you. I link to everything, and I mean everything we talk about, in the show notes right there in your app. You don't have to remember the terms she mentions. You can just enjoy the show and circle back later, or visit myalooffvagina.com for things we mention anytime. And you can also go there to find ways to get in touch with Dr. Wendy Chorny. This is her first appearance on the show, but I can't imagine it'll be her last. Dr. Wendy Chorny is a doctor of physical therapy. Plus, she has a lot of related certifications that elevate her understanding of women's bodies. And I've also listed those in the show notes. She specializes in the treatment of pelvic pain, pelvic floor dysfunction, postpartum and perimenopause-related disorders, and so much more. She is a practicing clinician, educator, and author, and is affiliated with the University of Dayton Doctor of Physical Therapy program, and currently doing research on diastasis recti in women. A disclaimer: though she is a doctor, she is not your doctor. Please consult a local professional for your particular medical needs and circumstances.
Let me tell you some nerdy facts. So we know that the vagina and the urethra need estrogen, okay? And if you've ever heard me talk about estrogen, I always like to say estrogen is a water-loving molecule, and it keeps things plump. So at 35, I don't care who you are, your hormones are decreasing in your 4th, in your 5th, in your 6th decade of life. As you go through perimenopause, then you hit your 1 day of menopause, and then you're postmenopausal, your hormones are continuing to decrease. And as they decrease, the water-loving molecules go away. So here are the fancy words. Estrogen regulates vaginal physiology. That is the smart way of saying what I just said. So then, because you don't have plump, yes, it's like filler, you know? So then you have a thinner mucosa, and that thinner mucosa means there's like little cracks, like the Sahara Desert in your vagina, and then pathogens and bacteria and yeast can get embedded in your skin. And then it's a whole thing. It's awful. So then because you have this estrogen issue, it's less elastic. There's less collagen. There is less vaginal rouge, which means your vagina is not as red. And I will tell you, I absolutely see this where vaginal tissue becomes more white It's kind of like a blanching like you see on your fingertips.
Uh-huh.
There's decreased blood flow, which means you don't heal as well. And this is my fact of yesterday. So, okay, as we age and we lose the estrogen, the vaginal blood flow decreases. So then, of course, it's going to decrease our lubrication for arousal. I don't know why I never linked those two together in my brain.
Right.
I mean, I was like, what? Yes, of course. Of course. So like you have less estrogen and maybe you had a baby. And so then you had trauma to your pelvic floor. So your muscles are weak. Your estrogen is dropping. So you have less plump tissues. And now because you're trying to not leak, you stop drinking water, but your tissues are thinner. You're giving yourself infections. Now you're going to have to get on an antibiotic, which is going to destroy your gut microbiome, which is already a shit show because you're perimenopausal, menopausal. Oh my gosh. It's a cycle.
And which is going to lead, I mean, I know not everyone believes this, but leads to depression.
No, it's true. So on this tangent, which isn't a tangent, this is stream of consciousness. Virginia Woolf would be very proud of us right now. So would James Joyce. Depression and perimenopause. Yesterday, the rabbit hole of perimenopause, menopause. I wanted to see the number of journal articles. What were they specifically talking about? Now, I've talked about pelvic floors for almost 20 years. I actually know my pelvic floor research inside and out. And anytime a new article comes out, I'm all in it. And I know about this. Traditionally, we talk about perimenopause by itself and not necessarily put pelvic floor and perimenopause together. Right. Usually they're separate articles and they shouldn't be. But perimenopause comes up so much in the journals with depression and anxiety. It is overwhelming the amount of research for depression and anxiety, which made me feel kind of validated when my hormones shifted, that my anxiety jumped up. But I will say we have been researching anxiety and depression in women, and it is real in perimenopause. So you're not crazy at all. You're not. These hormones, these sex hormones are protective to us. And we lose that protection, and now we're vulnerable to infection and inflammation. And inflammation in your brain looks like depression and anxiety.
Oh my gosh. Well, I'll share this because you're not a psychologist. I'm not a doctor at all. You're at least a doctor. If you combine this thing with the hormones, along with existential dread, right? and evidence that we're going to die someday, right? Because as we get older,
which is horrible. It is true. It is the circle of life. I learned that from The Lion King.
Yes. The Lion King taught us the circle of life. So media is showing you how old and decrepit you are and the youth culture. And so you're comparing yourself. So all the stuff's that happen at once. You go from plump and, shiny to the shift at the same time that your gut microbiome and the hormones are creating the conditions for anxiety and depression. No wonder that is such a common perimenopause situation.
What fresh hell is this?
Yes.
And P.S. I found a book called What Fresh Hell Is This?
Oh, is it good?
Talking about this. Yes.
Is it in the links that you sent me?
I think I have read it, but I haven't read it recently. Yeah. So I think I forgot that content.
Right.
But it does come on all at once.
Yeah.
And let me tell you some other nerdy things that talks about this. The way our culture treats it is quite horrid. Now, I'm from Ohio, and in Ohio, we have our sports and people are fanatics. And there is a little known university known as the Ohio State. So people outside of Ohio, when you put the Ohio State, they are just like, oh my goodness, why the emphasis on the? Because there's Ohio University. And they want to make a difference and show that they are the Ohio State. In the research prior to the 90s, it is the perimenopause. The perimenopause. What? But what's fascinating about the perimenopause is they don't want to call it a disease process. They call it a stage. It is only a phase. But there are so many diagnostic things that go along with it. But because it is a season of our life, not unlike puberty, nobody cares about the perimenopause.
Yeah. Yeah. Well, and I think, and you hit the nail on the head, our health system is not structured to be able to handle something that would
Prevention
require
is crap, apparently. I guess. Nobody cares about prevention.
They don't care about prevention, and they don't care about anything that might require some intervention or treatment or awareness or education that isn't also a pathology, right? If it can't be a disease state, they can't code it. They can't charge for it. Insurance doesn't know how to cover it. And so, so to call it a natural stage, they can just kind of take their hands off and say, well, this is what happens.
But see, here's where I'm going back and forth, because honestly, when you look at research journals in the OBGYN world, they are touted as the people that should be able to take care of us in the perimenopause. Once you're done catching the babies and once you have a baby, but having a baby is and isn't a disease process. Like, it has its own like coding. Like, we treat people that have babies well. Ish in the US, ish. I mean, I don't know.
Until the
I feel like
born.
It's very antiquated.
Yeah. Right.
And so, but no, perimenopause.
It's
just.
Did they pathologize pregnancy? Like, what if we treated the perimenopause, which is what I'm going to call it for the next week or so?
It cracks me up.
What if we treated the perimenopause the way we treat pregnancy?
Well, then I will tell you, there would be a lot of happier people in this world. So people want to make fun of menopausal and perimenopausal women. And I will say there was a tone in the research I was reading that I think healthcare providers were like looking at us like toddlers throwing a tantrum in Home Depot. And what do we do with them? Do we just subtly drag them off to a side aisle so the tantrum isn't in public? What do we do with these people? Which I've done that with my son while he was throwing a tantrum at Home Depot. And I did drag him to a side aisle. It's just like they're trying to pacify us. They're like, what do we do with them?
Yeah. How do we handle them? Because they're going to come on our office and they're going to make demands. Here's the positive thing. They're going to come on our office and they're at that stage in their life where they're not going to be silent at this, in
and
this
generation. They used to call us that. They used to call us whiny women. Whiny women. Oh, there's a, WW, whiny woman. But now that we are realizing that this hormone shift affects every facet of our tissues and our body, that we do have to start caring and supplementing. But people are afraid to talk about it because there's shame. Women's self-esteem, 44% of women that are in perimenopause have a decreased self-esteem. And I get why, because you're told beauty looks this way, and now you're beginning to look this way. And your hormones are shifting and your hair is dry and your skin is dry and your belly gets bigger. And it's just all these things. It's a bit disheartening and infuriating.
Well, and it's such a holistic thing. And I think that's the other reason our health system is not great with it, because they don't do well with holistic. They, just like you said, they don't do well with preventative. They don't do well with something that they don't have an explicit treatment for. Right. So if they don't have a pill or a course of treatment to provide that's easy to take and do, then they don't know what to do with us. Right.
Correct.
They can't
so
be successful.
Emergency medicine. Right. So what you're saying is there are no, to my knowledge, and if somebody finds this and I am wrong, I would love them to comment, so if some menopause guru hears me say this and I am wrong, please correct me. But in emergency medicine, so if you go to the ER, they have to make quick decisions based on what is happening to you to save your life, your quality of care, decrease pain. They do this with something called clinical prediction rules. And in women's health, it is quite rare that we even have clinical prediction rules, let alone for menopause. So a standard of care doesn't exactly exist. Now, if you look at the research, you do know that hormone replacement therapy has to be. We need those hormones. Even if you don't want to take a systemic hormone, you don't want to take a pill, you don't want to ingest it, a pea-size amount of estrogen, if you applied it to your vaginal tissues and that little bit, the inner third, the lower third, could change your life. we're so afraid because we had bad research and then there was this misinformation. And now women are terrified of hormone replacement because they think it's all going to give them cancer.
Hey there. This feels like a good time to pop in and remind you about the VFit Gold and that you can get 10% off with my code MAV10 or by using the link in the show notes. During my panicked research, when I first became concerned about my vagina, all signs pointed to the VFit. And here's the deal. Red light, gentle heat, and sonic technology encourage blood flow, which aids natural hydration and helps you improve sensation, pleasure, and intimacy, all from the privacy of your home. As you may recall, or you may have heard, I use mine scrolling Instagram, and nobody's the wiser. It also specifically helps promote a stronger pelvic floor and a bunch of other things that you can confirm on their website or with your own research. Just go to joylux.com and use code MAV10, as in my aloof vagina 10, or use the link in the show notes, and the discount will be automatically applied. You, your vaginal health, and comfort and pleasure can thank me later. Can we talk briefly about that article? And it isn't behind a paywall, so I can put a link in the show notes. What alarmed me the most, so this was an article in New York Times Magazine, and it kind of blew the lid off this idea that the Women's Health Initiative had been the biggest disservice to health care in, ever, maybe they want to say in 100 years. And so it's kind of a long article. I found it fascinating. But what alarmed me and shocked me, because I had been, I'm in the algorithm. I get all the vagina stuff and all the perimenopause stuff served up to me. So I already had awareness of some of the things. But the thing in that article that upset me the most, is probably the right way to describe it, is that they knew it was shoddy at the time. And that there were people saying, wait, no. But once it was picked up by like the Today Show, like with Ann Curry interviewing people, and once it was picked up and put into headlines and pre-internet clickbait, it became a belief. And so anyway, that's what upset me about that article, because I grew up believing it. I happened to work at AARP at the time, by the way. And so this was like doctrine, and I had believed it all these years. And a lot of my friends, their moms are of the age that they were going through menopause at the time. And so they have beaten into their daughters' heads that you can't use hormones, don't use hormones, it'll cause cancer. And a lot of my friends are like using like yam progesterone creams instead of, or over the counter stuff, because they've been so scared off of hormones based on what was basically a news cycle, a 1990s era news cycle.
Well, what's interesting is that there were that particular generation. So our mothers and their mothers, the news was fair, and I'm going to say balanced, because it was just different. Like, there was no spin to it back in the day. And that was very, very true. But like, time has changed and technology has changed. And so now we have to be our own investigative people and have a flexibility in our mind, but also as a scientist. And we had talked about this, that I constantly question why I believe what I believe, because science changes. We find new information and we have to pivot. We have to change, we have to pivot. But in that, they did us dirty. They did. But who's surprised that in a man's world, they did women dirty? No one. But this is why you give two chicks a microphone, a podcast. And here we are debunking this myth that has hurt women for decades.
The vagina debunkers.
And I have had to Yes, I am the vagina debunker. I'm Dr. Wendy Chorny, and I debunk bad science.
Yeah.
And I tell people, I have had to beg people. Okay. So we had talked about vaginal tissue and keeping it plump. And I talked about the mucosa and keeping the vaginal area pink and red and having good blood flow. sometimes on a vaginal exam, the first time I meet someone, if I'm going to look at their pelvic floor, if that's what I need to do on that day, and I see their vaginal area and it is so blanched and white. Now I'm talking about like white women,
like
but within the
Banicula,
vaginal.
like
Yes,
Banicula
and
and the vegetables.
we want things to be plump and pink, and they did not have enough blood flow. And then that is telling me and my brain as a scientist, okay, so this means that they're probably at least 2 to 3 years post-menopausal when the vaginal atrophy hits it hard. And then you are at risk for this really painful condition called lichen sclerosis, which is like little lesions on your vulva because you have this tissue crying out for estrogen, crying out for estrogen. And steroid cream is not going to fix a tissue that is crying out for estrogen. It actually will only make it thinner and weaker. And then these women, I beg them to go see a specialty OBGYN, a specialty gynecologist that specializes in dermatology, because there is nothing other than estrogen that can save that vaginal tissue that is painful. And they get infections because they get those little cracks because it is dry like the Sahara Desert. There is nothing else that can save that.
So I know that we had things we wanted to cover. I'm going to have to bring you back. I hope that works for you. But before
that is acceptable. I do accept this.
Thank you. Thank you. There's more vagina debunking that needs to be done. So you'll have to.
Yes, we are the investigators of the vagina debunking. Yes.
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 What you and I had spoken briefly, and I just wanted to make sure I had you talk about it, about the idea that when we talk to women in their 30s or even their 40s and say, oh, and they have all these symptoms, all these traits of perimenopause, and we say, oh gosh, it sounds like you're in perimenopause, and they freak out and they're in denial. Can we talk about that age?
Yes.
Yes.
Because it's bad information.
Yeah.
So perimenopause can start as early as 35 to 45. And when all these symptoms, these phantom crazy symptoms that seem to not match, and it's not your thyroid, I'm going to tell you it's perimenopause, because education is power. And they get all frustrated at me. And it's not unlike when I have a person who is in their 30s or even late 20s who has an exceptionally painful and arthritic joint. Because arthritis is just wear and tear. Osteoarthritis is just wear and tear. If you had a car wreck, if you were a collegiate athlete, you're going to have degenerative changes because of wear and tear. If you have a vagina, you will have a hormone shift, and it can shift if you've had surgery. It can shift based on your socioeconomic, if you drink, if you have alcohol, like in your life. And there's all these reasons, but people think perimenopause isn't really a thing. They think of menopause, which is just really one day. It's, a year after your last period. So there's really perimenopause and postmenopause, but there's this bad information. And then when you tell them, hey, listen, this is happening to you, and I want you to know that the suffering you're experiencing, you're not crazy. And they're like, I get a regular period. I have my period every month. And so yesterday in my research, there are stages of perimenopause, and in the early beginning and mid stages of perimenopause, there won't be a change in your period, ladies. It's going to look like irritability, anxiety 2 days before your period, a high LDL, blood pressure, PVCs where your heart races. And so these women are having cardiac issues and dental issues. And we're not telling them that, hey, it's your hormones. We have to support your hormones. Also, widespread joint pain, brain fog, walking to the basement, and you don't even remember why you're there. Walk back upstairs. Oh, now I remember. Walk back down. You forgot. Oh my gosh, am I crazy? Mm-hmm. So I feel that along with hormone replacement therapy, we need to tell people it isn't the devil. We need to tell people perimenopause exists, and it comes earlier than you realized, and we can help you if you acknowledge what it is and we have real conversations.
Yay!
Which, by the way, how do you find a person to help you?
How do you?
If you want, it would have to be, if you go to the North American Menopause Society, you can click your zip code into the box, the drop down box, and find a healthcare provider in your area, because only people truly trained in taking care of menopausal, perimenopausal women will get it and understand you. Because if not, gaslighting could exist.
Yes.
The sad part is women want to go to their OBGYN because we do think that, but like, no offense, they're phenomenal surgeons. They're great at catching babies, but they are not trained in perimenopause and menopause.
So that message alone is one of the reasons that you and I are just like simpatico, because as soon as I found that out, I started screaming it from the rooftops, because of course we thought it was our gynecologist. That's our lady doctor. That's who you think you're going to go to. And it's not.
And if you're lucky, maybe they know it, but they might not.
But even if they know it, I mean, if you're lucky, they might be certified. If you're lucky, they're paying attention and they're keeping up on it. If you're lucky, they believe in interventions are going to support you. But why not go to an endocrinologist or a specialist for what is a hormone issue? Someone who that is their focus, right? Or other health, women's healthcare.
Absolutely. So it's multifactorial, but you know, the reason I feel strongly and we're sharing this is we want to keep our tissues healthy to prevent the future damage that is happening to so many women because they didn't know they were behind.
Yes.
They didn't even know it was an option. So a hydrated tissue acts younger. Yeah. When you have hydration in your tissues, a hydrated tissue looks younger, acts younger, thinks younger, is younger. And without having the proper estrogen and water metabolism, your tissues are going to act pathologically crazy. And you're going to have frozen shoulder and tendinitis and joint pain, brain fog. I mean, it just goes on. Bladder infections.
Yeah.
So plump and hydrated is the message.
And
plump
where do we get our plumpness in our bodies? Our estrogen.
It's a water loving molecule, you know.
Oh, I'm so excited.
So
this is great.
That's the fun.
Thank you.
Well, thank you for having me on the vagina monologue that could go on for days.
Well, just in little 29-minute segments, right? And then we'll just do that. We'll just keep telling the story. Because
we want people to have the digestible bits about their bits.
Yes, right. And women, listen, it's not that I don't listen to 2-hour long podcasts or 90-minute long podcasts or even 1 hour long podcasts. I do, but I cannot listen to them typically in one session. And so I wanted these shows to be something a woman could listen to on the way to wherever she's going, while she's cleaning the house, while she's working out, and get the whole story at once. So
digestible bits and a takeaway that they can have to help change who they are today. It doesn't need to be overwhelming or complex.
No,
it has to be real.
Thank you, Dr. Wendy. I love it.
Thank you. It was a lovely date.
Yes, it was.
A really nice date.
I like your dress.
Oh, thank you. It's Amazon.
That's perfect.
Of course it is.
Thank you for listening. Until next time, take care of yourself and take care of your vagina. If you enjoyed this episode, please share it with a friend you think would enjoy it too.